Bryan-Morrey, Triceps-Sparing approach. The video was produced based on a literary work. I would like to express my gratitude to the editors, Mark D. Miller and his colleagues, for their valuable contributions. Citation: Orthopedic Surgical Approaches. Miller, Mark D., Anakar Chabra, James A. Brown, Joseph S. Park, Francis H. Shen, and David B. Weiss. Orthopedic Surgical Approaches, 2008, Elsevier, Saunders, 2015. For more information, the book mentioned above is available for purchase and reading. Indications: open reduction, internal fixation of supracondylar and intercondylar, humerus fractures, total elbow arthroplasty, and removal of loose bodies. Positioning: the patient is in the lateral decubitus position with the operative arm across the chest and the elbow in flexion. Incision: identify surface anatomy, including the medial epicondyle, lateral epicondyle, olecranon, and ulnar nerve within the cubital tunnel. A longitudinal incision is made at the posterior aspect of the humerus beginning 10 cm, proximal to the olecranon, curving medially or laterally around the olecranon, and continuing distally over the ulnar border. Superficial dissection: incise skin and subcutaneous tissues, identify and isolate the ulnar nerve as it emerges from the medial intramuscular septum and enters the cubital tunnel. Transpose the ulnar nerve anteriorly after decompression and excision of the medial intermuscular septum.
Deep dissection: identify the medial aspect of the triceps muscle and bluntly release the fascia to reflect the muscle laterally. Release the triceps from the entire distal humerus, taking care to avoid releasing too proximally and injuring the radial nerve within the radial groove. Elevate the entire triceps insertion and periosteal expansion of the ulna to expose the distal humerus. Take care so that the triceps mechanism is not disrupted transversely. Bring the elbow into full flexion to identify the lateral ulnar collateral ligament and medial collateral ligament. Protect the ligaments during fracture fixation. With the elbow extensor mechanism reflected laterally, the entire ulnohumeral joint can be exposed if more exposure is needed. The olecranon process tip can be osteotomized. Closure: reapproximate all intervals and repair the insertion site of the triceps. Drill 2 holes in a cruciate manner across the olecranon. Reapproximate the triceps tendon over the olecranon and pass a suture from distal to proximal through one hole up the triceps tendon using a Bunnell-type technique, and pass it back through the olecranon from proximal to distal using the opposite drill hole. Transpose the ulnar nerve. Close skin and subcutaneous tissue with suture or staples. Hazards: the radial nerve running in the radial groove of the humerus when elevating the medial triceps, the ulnar nerve during the initial exposure.
The video was produced based on a literary work. I would like to express my gratitude to the editors, Mark D. Miller and his colleagues, for their valuable contributions. Citation: Orthopedic Surgical Approaches. Miller, Mark D., Anakar Chabra, James A. Brown, Joseph S. Park, Francis H. Shen, and David B. Weiss. Orthopedic Surgical Approaches, 2008, Elsevier, Saunders, 2015. For more information, the book mentioned above is available for purchase and reading.
Thanks for watching. Subscribe.